I'm Cheryl Martin, here to introduce you to the president of USAT, Orien Tulp.
Thank you.
And Dr. Stephen Rudin.
How do you do? Nice to meet you.
You too. Can you tell us a bit about what USAT offers to doctors in the community?
Well, USAT is a unique school. We have a bridge program that is a true bridge program to accommodate healthcare professionals to bridge into medicine. So those that have gone halfway to become a mid-level provider can easily go the other half of the direction to become an MD in about 2.5 to 3 years, a full year shorter than in a U.S. medical school. They come in with a considerable amount of collateral medical education and experience that is not found in traditional U.S. medical students at all. And they do very well in the remainder of their career. It enables them to qualify for U.S. residencies. They qualify at a rate similar to that of U.S. graduates of U.S. medical schools, and they get the same specialties and the same opportunities.
Where's the school located?
The main campus of the university is in Montserrat in the British West Indies, where we're one of a few Caribbean schools that they actually own our own campus. It's the largest of any Caribbean school. It's fully equipped, complete with its own satellite communications network, so that we can broadcast lectures around the world. We have a very large student body, around 1,200 students, more than almost any other medical school. The average U.S. medical school has at most about 400 students, most of them. So we're doing very well on our numbers and on our, the total number of graduates that we produce annually.
What is the average incoming student entering as professionally?
They come in entering typically as a mid-level provider, and most of them I would guess are making about $100,000 a year as a mid-level provider. The unique advantage of our school is we give our lectures on weekends instead of during the week, which enables them to continue their primary employment, and so that by the time they graduate, they have little, if any, outstanding medical school debt. And that is a remarkable advantage when you start medical school, considering that most graduates of U.S. and some Caribbean medical schools, international medical schools, will come on board with up to $400,000 to $500,000 in debt. Usually $200,000 to $500,000 in debt in student loans, which now becomes a very significant burden as they begin their medical career, because their greatest cash outlays are on the first part of their career, and now they're burdened with that huge student loan at the same time. USAT students do not have that burden, because they enter with a good credit rating. They do not owe any medical school debt, and they can they can easily complete their medical degree and their residency program without financial interference. That's a very big thing nowadays.
It sure is.
Medical schools are very expensive. They don't need to be that expensive.
So how would people get more information about your school?
Well, they can go to our website, www.usatedu.org, and that'll give them all the information, including the application, the residency selection locations that we've had. We have quite a few across the United States, in almost every state, and almost every specialty.
Wonderful.
So.
We apologize for the background noise you may be picking up. We are actually on location in a conference right now with USAT. Dr. Rudin, can you tell me how you participate in these classes?
Certainly, Cheryl. I'm professor of behavioral medicine and behavioral sciences, and it is my role to introduce the students to mental health disorders, how to identify them, how to treat them, and also from a pharmacology standpoint, understanding the medications that are used in the management of mental disorders, and perhaps just as important as understanding medications, their side effects, when and how to use them, is knowing when not to use them. That's an essential part of the education and training as well.
Absolutely. So you said you're in behavioral medicine. Is there any sort of behavioral health issues that you find most important to educate the students on today?
Well, I think awareness is important. My mantra, I think some of them think my middle name is history. I think it's incredibly important to be aware of the importance that a really good, thorough, not just medical, but family history is. And it's interesting because we're living in an exciting time in this country from the standpoint of many different cultures. And as we become acculturated, it poses its own problems in terms of taking mental history, because I remember as a child being a first-generation American myself. I can remember as a child understanding enough of other languages to know that what they were saying is, you never hang your dirty laundry on a public line. It was not until my mother had passed for many years before a relative advised me that my own mother had suffered an anxiety attack, and a really significant one, many, many years before I would ever know anything about it. And what's interesting is that it really impacts on our children and our grandchildren, because as we learn more about the chemistry of the body, we're finding out that more and more emotional conditions have a family component to it. So I suppose what I'm trying to get them to do is pass along to the American people in general, don't be ashamed and worried and afraid to talk about a history of a mental disorder. It's a lot different saying to somebody, you know, when I was young, I had anxiety. And by passing that on, should your own child or your grandchild show signs of that, that knowledge can help them get the kind of medical help and attention or counseling or whatever they may need very quickly. So I think that a very important role I have is to help everybody learn the importance of history and heighten awareness in the general population.
What do you find to be the top 3 disorders that are the most prevalent today?
Well, partly the way the world is going. Probably anxiety is a very important one. Depression, another one. Some forms of anxiety associated with stress and trauma, as there is more fear and general fear in different parts of the world. I think it's a global problem. If you never know when the next rocket is going to come in, if you never know when the next terrorist is going to attack, there tends to be a heightened, almost paranoid flavor of looking over your shoulder. And that is a real concern as well, but probably anxiety and depression disorders, because they're clusters, they're families, are the top 2 of greatest common concern.
Do you find that most anxiety disorders are hereditary, or could they also be based on what people are experiencing in their life?
Yes.
Yes. A little bit of both.
Exactly. It's a nature-nurture kind of problem. You do not inherit a biologically based mental disorder. You don't inherit any mental disorder. What you do is you inherit perhaps an increased genetic predisposition for it.
Right.
And so the environment then takes over, and it's the way you handle stress in your life. It's the extent of the stress, the trauma you may experience, that ultimately makes the determination as to whether or not you're going to show that disorder or not. So it's really a combination.
So even if someone were to speak to their family and find there was no history, they could have developed an anxiety disorder based on circumstances in their life.
Absolutely, absolutely. And I think it's important for parents to realize that if their children do show signs of it, that this is not the time to run around and saying, oh my Lord, I passed this on to my child, I'm a bad parent. No, it's a combination of nature and nurture, genetics, and how well our coping skills work for us.
What would you recommend someone to do if they felt that they had any sort of mental health issue going on?
Probably the number one place to start is to talk to your primary healthcare provider. And then he or she can decide whether it's something that can be handled simply or whether or not you need a mental health provider in the form of psychiatry, psychology, licensed clinical social worker. There are many options. For some people, they choose a pastoral counselor, but depending upon the disorder, the best referrals come from the person who knows you the best, and that should be your primary health care provider.
So you're here in Miami today participating in these conferences. What is it that you're teaching the students this time?
Today we were looking at personality disorders. Very, very interesting cluster of things which are, well, the word we use is pervasive. In other words, it affects your behavior everywhere. The average individual is capable of altering parts of his behavior or her behavior, parts of our personality, depending upon the situation. You have one way of behaving at a wild party on a Saturday night. That sounds good. You have a way of behaving when you are in church, mosque, synagogue. You have a way of behaving when you go to the store. You have a way to behave which is typical when you're sitting in a classroom. But when people become disordered is when they can't adapt their behaviors to the situation as it changes. And then they are who they are, who they are, who they are. And that is highly maladaptive because it means that they're going to have serious problems in interpersonal relationships, in the ability to function effectively at work and get promotions. Personality problems are interpersonal problems, and they're quite serious, and very few of them are responsive to medication. The vast majority of people who have these get depressed. We have medicines for depression and treatments for depression. They get anxious. We can treat those too. But the core, that takes a lot of hard work. And there's an old story, an old joke. How many shrinks does it take to change a light bulb? Only one, but the light bulb has to want to be changed. And so if the person wants to dig in and work, yes, they're manageable. If they don't, they're not going to get better. So it's an interesting cluster, and we spent a total of 4 hours looking at those things, and I think it was very informative for the people who are here today.
It's a fascinating topic.
It is.
And that also is an important element of the U.S. medical licensing examination series nowadays, both in the clinical evaluation stage and in the test-taking stage, which they do in the first two parts.
Absolutely.
They have to know a tremendous about psychiatry and behavioral medicine and psychopharmacology when they sit for that exam. That's right. That is probably the toughest exam they will ever take, and the U.S. has the toughest exam of all. So relax the theory that it's easy to get a license in the United States. This is by far the most strict licensure country in the world for medical licensing, and the best. The medical education in the United States and in U.S.-based curriculums is the strongest in the world. And there's absolutely no discussion about that whatsoever. Everyone else follows the U.S. on medical education.
And I must say that USAT works very, very hard at making sure that the students know their material and work hard, and that's one of the exciting things about teaching here.
It's fun because our students, they score very well. Our students on average score higher than the U.S. graduates of U.S. medical schools on the same exams.
Why do you think that is?
Well, because they have a lot of collateral medical education when they start. They have incredible motivation, and between you and me, and I think Dr. Rudin would agree, that motivation is the single greatest factor in success.
Yes, absolutely.
And if they're motivated, they may work a little harder than someone else, but they will get there, and they will get there with stars on. They do extremely well.
And of course, we never say that we have great faculty.
You
have no idea what a pleasure
faculty.
it is working with my colleagues here.
We have had many students score in the top 1% nationwide.
Well, Dr. Tulp, I think that your classes are about to begin. It was a joy to learn about your school today and to meet with you.
Thank you.
Also with you as well. Thank you for sitting with us and
My
sharing your
pleasure, Cheryl.
expertise. Thank you for joining us today, and we look forward to bringing you more information on USAT in the future. For this afternoon, I'm Cheryl Martin. Have a great day.